Digoxin is a drug which is used in the treatment of certain heart conditions, particularly those involving impaired cardiac contractility and abnormal heart rhythms. It is involving in cardiac glycoside group because of its positive inotropic and negative chronotropic effects. Let's talk about positive inotropic effect of digoxin. That means it helps in increasing the force of heart muscle contraction. How it facilitates increasing force of contraction? By increasing the intracellular calcium levels, where calcium ion has the capability of exciting cardiomyocytes, the heart cells. So it can be used in situations where our heart needs a support for its contraction. Obviously, it can be used in case of heart failure, which is a condition in which heart muscle cannot pump enough blood to meet body's need for blood and oxygen. How the negative chronotropic effect works? By the reduction of heart rate, that means reducing the ventricular rate. How it facilitates reduction of heart rate? By stimulating the vagus nerve or parasympathetic activity and by slowing conduction through AV node. So, it can be used in situations where reduction of ventricular rate is essential. For example, atrial fibrillation and atrial flutter. In atrial fibrillation and atrial flutter, reduction of ventricular rate is important. In atrial fibrillation, atria contracts at 350 to 600 beats per minute irregularly and rapidly, whereas in atrial flutter, it contracts at the rate of 250 to 350 beats per minute regularly and rapidly. In both these arrhythmias, the impulses from the atria may travel through the AV node and reaches to the ventricle, causing the ventricular rate more irregular, even though not all contractions from the atria is not transmitting towards the ventricle because of the filtering mechanism of the AV node. But because of the relative increase in the ventricular rate in both these instances, reduction of ventricular rate is important. Remember, digoxin does not correct rhythm abnormalities of atria in atrial fibrillation and flutter, only reducing the ventricular rate. To correct the atrial rhythm abnormality, we may need antiarrhythmic drug or catheter ablation or some other treatment. And in case of heart failure also, it doesn't serve as first line management. Depending upon heart failure is acute or chronic, we may need oxygenation, diuretics, ACE inhibitors, beta blockers or more fastly acting dopamines and dobutamins. Therapeutic blood levels of digoxin should be between 0.8 to 2 nanogram per ml. If it is greater than 2 nanogram per ml, it causes digoxin toxicity. Toxicity can be aggravated by age, kidney failure, hypokalemia, hypomagnesemia, and hypercalcemia. As age increases, the kidney function may get impaired. It will reduce digoxin clearance. And in case of hypokalemia, hypomagnesemia, and hypercalcemia, it enhances the effect of digoxin on cardiomyocytes. Digoxin toxicity symptoms: bradycardia because it reduces the heart rate, AV block because it reduces signal transmission through AV node, gastrointestinal symptoms like nausea, vomiting, loss of appetite, neurological symptoms like confusion, delirium, and drowsiness, vision problems like blurred vision and green-yellow halos around the light. Let's check nurse's role while giving digoxin. Assess apical pulse for 1 full minute. Hold the dose if heart rate less than 60 bpm for adult, less than 70 bpm for child, or less than 90 bpm for infant. For infant, less than 60 is considered as no pulse. Assess electrolyte levels of potassium, calcium, and magnesium. Review serum digoxin levels. Assess renal function. Route of administration should be checked. It can be given as oral and IV route. Monitor for heart rate and toxicity after administration and encourage in the intake of potassium-rich diet like bananas and oranges as hypokalemia increases the toxicity. Instruct the caregivers how to check pulse at home. In case of toxicity, give the antidote of digoxin, digoxin immune fab or digifab. Can you answer a question? Thomas, 72-year-old male, comes to the emergency department with complaints of nausea, vomiting, and abdominal discomfort and problem with vision. He complains of green halos around his vision and he is confused. The nurse must anticipate which drug he might have taken. Options are digoxin, aspirin, pantoprazole. Comment your answer below.